3 formulas, 1 zone, and the same question in every intake. Which one? This is the upper respiratory microbiome, the upper Jiao, and in the next few minutes I'll walk you through the differentiation that sorts Warm Hearth, Wind, and Peak, the way I actually use it in clinic. These 3 are not interchangeable, and the differentiation between them is not subtle once you know what you're looking at. Patients guess. They buy the one with the best description, or they buy all 3 and rotate. Our job is to sort the pattern before the formula. Temperature and moisture differentiate every biome on Earth, and equally the living microbiomes inside the body. That's the model the whole Botanical Biohacking line is organized around, and it maps cleanly onto what we already do. When the microbiome of a zone drifts, the presentation turns contradictory, hot and cold, dry and damp, vacuity and repletion, all in the same patient. That isn't a failed differentiation. It means you're not looking at one organ. You're looking at growing conditions that drifted. So the upper Jiao gets a spectrum and you place the patient on it. Warm Hearth at the cold end, the 2-age decoction with the 2 attractilodes for phlegm, damp, mucus, and biofilm. Wind in the damp middle. Minor buplurum combined with the 3-seed decoction, and Peak at the hot end, the same 3-seed base strengthened for heat. The classical names are on the slide. 2 questions differentiate them in this order. Question 1, is this mucus or is this fluid? Phlegm and thin fluids behave differently, and they call for different formulas. Mucus and biofilm is the chronic, sticky, structural picture, turbid phlegm, snoring, sleep apnea, post-nasal drip that has been there for years rather than weeks. The mucus runs clear and white, not yellow. If it's chronic and sticky, that patient is in the phlegm lane. Fluid retention is a different animal. Thin damp rather than sticky phlegm. Heavy, sluggish, and foggy. Slow to wake. A generalized feeling of dread and dreams of being chased. No real desire to drink water. Needing to bear down to move the bowels. That's the picture Wind and Peak are built for. The first fork, plainly, phlegm sends you to Warm Hearth, fluid sends you to Wind or Peak. Question 2, is heat riding on top? In this zone, the hot pattern is usually the cold pattern plus heat signs, not a separate presentation. So learn the cold picture first and watch for what gets added. Real thirst, wanting cold drinks specifically, dry mouth and headache, yellow mucus, red eyes, a red tongue body with a thick yellow coat, an axillary odor, stinky armpits, which is an underrated tell. 4 screening questions get you most of the way there in under a minute of intake. Do you have a dry mouth? Do you feel thirsty? Do you bear down with bowel movements? And do you have environmental sensitivities or allergies? The 2-age decoction is the base formula for phlegm damp in our medicine. Nearly every phlegm formula in the tradition is built on top of it. It's the footing. It rarely gets the credit, and almost everything sits on it. Warm Hearth is the classical modification that adds the 2 great damp-drying attractilodes, white and black, for stronger fortifying and drying action, warming, transforming phlegm, clearing biofilm, opening obstruction in the upper respiratory tract. Remember, it's drying by design. A patient with a dry constitution is the wrong candidate. Wind is for the patient stuck in Xiao, neither sick nor well, weeks after everyone else bounced back. Alternating chills and warmth, bitter taste, no appetite. It's built on minor buplurum decoction, the definitive harmonizing formula for that half exterior, half interior layer, with 3-seed herbs layered in for the damp sluggishness that rides along with modern constitutions. And the detail that decides Wind versus Peak is 1 herb. Wind carries super high-grade white ginseng, added by the formulating pharmacology professor specifically so it doesn't drain qi over a course. Most versions on the market substitute Codonopsis to cut cost. Win uses real ginseng. That's structural, not marketing. Peak is the same two classical formulas aimed at a different patient entirely. The heat-clearing side is strengthened with virgate wormwood and with buplurum sourced from the Tibetan plateau, and the ginseng is deliberately left out, so the prescribing rule is as plain as the formulators stated. More relative vacuity wind, more repletion and heat peak. The 3-seed decoction has a datable origin, the systematic differentiation of warm diseases, published in 1813. Its description of damp warmth still reads like a modern chart note, and the section on errors is the sophisticated part, sweating the patient clouds the clear yang, purging leaks the qi, and moistening drives the damp deeper, a catch-22, and this formula was the answer to it. In practice, you often combine rather than choose. The stated pairing is Warm Hearth with Peak for phlegm and biofilm with heat riding on top, yellow mucus, red eyes, sore throat over the chronic drip. When the presenting complaint isn't respiratory at all, but a Xiao Yang layer is holding it in place, wind is the one to reach for. On course, the 3-seed base is a targeted tool, not a daily forever tea, roughly 2 weeks, never longer than 3 months, because over time it can drain qi, and both wind and peak are seasonal, shipping September through June with a pause in high summer. One sequencing point that's easy to miss. Clearing the lingering dampness is often what makes the rest of the case legible. Once it clears, the simple pattern is finally visible underneath, and what's left is frequently 1 or 2 bags of something straightforward rather than a complicated protocol. So, the whole differentiation in one line: phlegm, warm hearth, fluid, wind, or peak, heat riding on top, peak. The full write-up with complete herb lists and sign inventories is on the Valley Health Clinic blog. Thanks for watching.